So welcome back to part 2 of our evening. How was the break?
Short.
Yeah, tell me about it. I was so busy on Facebook that I didn't eat my lunch. So I'm gonna do the next best thing, which is eat an apple turnover. Why are y'all always so quiet?
Why don't you just eat your dinner like while you give class?
Because you guys are gonna be doing all the talking.
Oh.
So yeah, in a way I can, but I gotta go into the break room. I gotta serve up the enchiladas. I gotta go to the microwave. I gotta put them for a minute and a half. I gotta take them out, walk over here. It's too much work.
That's just like 5 minutes.
Exactly. It's too much work. So anyway, so as I mentioned, you see your screen? How it says sign or symptom and then clinical implication?
Mm-hmm.
Well,
Yeah.
guess what? So let me look at some names that I haven't really heard from today. Have I heard much from you today, Andrew?
Yes, sir. I was talking about the head with the skull crushed and the trauma and all that stuff in the beginning of the chapter.
All right. How about you, Jonathan?
Yeah, but I'll give it a shot.
All right.
Can you hear me?
Yeah, I did. I was just thinking. All right. So, Jonathan, so you guys think about it. Don't answer now. So what's going to happen is I want you guys to take the information that you learned about abdominal injuries and give me the clinical implication of the sign or symptom. So, and some of them have to do with this specifically, others don't. But that's what I want you to do. So, Jonathan, you'll take pale moist skin. Andrew, I want you to take diffuse pain. Sonia, I want you to take localizable pain. Cecilia, I want you to take tearing pain. Ina, I want you to take shoulder pain. Vivian, I want you to take narrow pulse pressure. Dylan, did I give you one already, Dylan?
No.
All right, I want you to take knees drawn up to the chest. And Vanessa, I want you to take arms folded across the abdomen.
Okay.
So guys, work on it a little bit.
You said I got diffuse pain?
Yes.
All right.
So why am I doing this?
Doing what?
Why am I having you guys do this?
Just familiarize us with different signs and symptoms.
Yes. And some of these we've talked about in the past. But when you think back to medical emergencies, remember I talked about how abdominal pain can be very, very complex,
Yes.
especially a woman of childbearing age complaining of abdominal pain. And so you have to broaden your horizons. Now, granted, with abdominal pain caused from a traumatic event, it's a little bit you kind of think about the structures that are underneath. However, we still have to kind of think about what else could be going on. You got a pregnant woman, and she suffers an abdominal injury. And we'll talk about this when we get to childbirth. What could have happened? What are the possible complications or implications of that injury?
Miscarriage.
Now, the other reason I'm doing this is to see if you guys read the chapter, which I already know the answer. But it's to see if you guys read.
Question.
Somebody walking behind you, Brisa. Are you going to smack that person later? So for those of you that didn't get one, didn't you get one, Ina?
What?
One of these?
What?
One of these signs and symptoms?
I still have it.
Did you work on it? You done?
Yeah,
Okay.
kind of, I think. Oh, I don't know.
For those of you that didn't get one, kind of start working on them, see what you come up with. I think do you guys need another 5 minutes?
No.
You're losing it, Ina.
I am. I'm sorry. I gotta get up at 4 to go to work.
Well, we'll be done early.
Let me see. Signs or symptoms. Clinical implication.
Do you guys know that after today, we only meet 12 more times? And out of those 12 times, there's 3 tests, which includes the final?
Yes.
It's
Somebody
12.
was excited with the tone of voice.
It's kind of scary.
Yeah.
It is scary.
I remember when I was doing I never got, the only word I heard from Elite today was from Mario, and he stopped by to talk to my morning EMT class, or the ones that were here.
Okay. I forwarded Rob all your information. How many more students do you have left to schedule?
Well, I've got to get you guys scheduled.
Okay.
But the thing is, Christina's been out of commission for the last couple weeks. So I don't know where we stand, and she was supposed to have called me last week and I didn't hear from her.
Okay. Well, I talked to Rob today during our Monday meeting because we have like an ops meeting every Monday.
Uh-huh.
And I was telling him how like we've been trying to get stuff scheduled, but we haven't been able to. So he said he was going to take over and start doing that.
Okay.
So that's good because he'll get it done, and he doesn't have to ask anybody for permission to do anything. He may have just lost track of time, but I'll follow up with him in the morning.
Oh, no
and just
worries.
let him know.
No
So we
worries.
can get everybody scheduled or get everything going.
I know that we all get busy. Believe me, I got busy, and it happens. It really does happen. So I'm really worried about you guys getting done.
Okay.
They've been fighting out with Dominion, and they've been getting their contacts through Dominion.
Okay. I'll follow up with him in the morning for sure.
How many openings do you have for Dominion?
We have 3 shifts a day with Dominion.
And we all have to do 4, correct?
Yes.
Okay. And if they let us do night shifts, are we okay with to do night shifts or no?
Yes. Well, at least if I can.
Lou?
The answer to that question is it depends on the provider,
Okay.
because it's usually no.
Oh. On it, it's usually no from the provider?
Yes.
Okay. Okay.
Yeah, but the only one that allows overnights is Sierra Blanca. But yeah, we got to get you guys started on ambulance. Anyway, what brought up the initial conversation was, I remember when I went out to do my ambulance ride-outs, I was scared shitless. And I remember the first call we got was in a facility, but I was still nervous. Am I going to remember what to do? Am I going to know how to talk to the patient? And it was a piece of cake. Inner facilities are a lot different than they are than 911 calls are. The cool thing about what we do is that you're not expected to be at the top of your game on day one. There's going to be a lot of stuff you're going to learn over the years. With experience, it's all going to come together. Okay? So just have the knowledge, which is kind of what this exercise is about, is you guys reading ahead, getting that knowledge, being able to put it together. Now, if you end up working for a company like Dominion, more often than not, all you're going to do is inner facilities. They're a lot easier calls to deal with because they've already been diagnosed. It's a real simple transport. You pick them up from wherever and you take them to their destination. You pick
But
them
you
up
still
first.
you still do the vitals and all that
Yeah,
stuff.
yeah,
Mhm.
and that's all part of monitoring your patient around. Don't be lazy and do one set of vitals, and that one set was taken by the nurse 10 minutes before you got there. No, that's not doing your job. You get a set of vitals when you first show up. You take a set of vitals. If it's been 15 minutes, then you load them up, or as soon as you get there. And then when you get to your destination, that's taking care of your patient. All right, you guys ready?
Oh shit.
Yeah.
Are you guys ready?
Yes.
That sounds like a no. All right. So, Jonathan, you had pale moist skin. So tell me the clinical implication of that. Why is it important? What is it telling us?
It's a likely indicator of shock.
Okay. So what else is it telling us?
That there's no severe injury. Since we're talking about the abdomen, it could be like a blunt or penetrating trauma to any of the solid or hollow organs.
Okay. So, sign of shock. How is it meaningful or indicative with a pediatric patient?
Like, what are the signs of shock in pediatric patients?
No, I mean, if you have a patient, a pediatric patient with pale moist skin, why is it more important to be able to recognize that with a pediatric patient?
Is their ability to compensate it's not that adequate?
Okay. So, but that's sensitive as a shock. But what I'm saying is, why would be, actually, I can't say it that way. If we see a pediatric patient with signs and symptoms of shock, and they've suffered an abdominal injury, why is that cause for concern?
Because there could be a lot of the organs could be damaged
Why?
because it's a small body, so they're all accumulated into that
Okay.
abdominal region.
And that's the thing right there. Remember, everybody, that because they are smaller, because everything is much closer together and closer to the surface, there's a higher risk of abdominal injuries. I told you guys about the lap belts in the back seats before they had shoulder belts.
I don't think you did you?
Okay. So back in the day, back in the 70s, they had, and 60s, they had lap belts. Only lap belts in the rear seats. What they noticed a lot of was kids dying as a result of abdominal injuries and traffic accidents.
Because they would
And
fold, right?
Exactly. Because they would fold, because the momentum would have them keep going forward, but that seatbelt held them in place. Well, that was a bad thing because of the smaller area. It would cause injuries to the abdominal aorta, and they would bleed out. So as a result, they came out with shoulder belts in the back seats. And so that's why vehicles now have both lap belts and shoulder belts in the back. All right. Anybody else have anything to say on the pale moist skin? So again, why? So Miss Joanna, I don't see your dot.
No,
because my camera's on.
So why, other than being a sign of shock, why does the body become pale and moist? Pale, cold, and moist.
Probably circulation.
What about the circulation?
It's not getting enough blood flow, like depending the injury.
Okay, so what's happening?
Probably blood's not going through like the heart or something.
Okay. So tell me more. Based on the information that I've given you as before, as to why the pale becomes cool and clammy, why does the person become pale, cool, and clammy?
It could be either the punctured lung or the rib affecting it.
Well, it's more than just the specific injury. We know that it's a normal sympathetic response. So why is the patient going to have pale, cool, clammy skin? And this is in general.
The skin is shunty.
The skin is shunting. What does that mean?
The capillaries are closing.
Okay. And why are they closing?
Because the body's trying to compensate other important organs.
Okay, so they're compensated. Okay. Yeah, remember they're compensating to keep blood at the core because the most important organs are at the core of the body. So it shunts off blood flow to the unimportant areas, such as the skin. All right. So Andrew, talk to us about diffuse pain.
Wouldn't it be like a widespread of pain? Like, well, since it's abdominal trauma, wouldn't it like be affecting the major organs of the abdomen? So, say if one were to rupture, it would affect a whole bunch of the other ones.
Run that by me again.
Like, since it's the abdomen, like we're covering abdomen trauma. So, like, if one of the important organs were to like rupture, like say like the appendix, wouldn't it like cause really bad pain to the other important organs, causing the fusion of pain?
It might not necessarily be severe though. Because what's the thing about nerve endings and organs, abdominal organs? Anybody? No? Anybody? Nobody? Well, I was hoping to be out of here at 9 o'clock. I guess that ain't happening.
What's the question?
Can you repeat your question?
I forgot it now. Oh, what's the thing about nerve endings and organs, abdominal organs?
Is it that they don't have any?
No, they do.
Well, they like radiate elsewhere.
Okay.
Oh, like if you, I can't remember if it was like the appendicitis or you like feel it in your shoulder. Is that,
No,
I can't remember if it was that one, but
it's close, but that's a different one. Excuse me. Nerve endings. Some abdominal organs do have nerve endings directly on them, and some of them don't. And that's where we get with diffuse pain is that they don't necessarily, they do pertain to an organ, but you can't really localize it. It's kind of spread out. So that's what diffuse pain is. Now, as far as localizable pain, who had that one?
Not me.
That was me.
Okay, go for it.
We're like explaining like what's important about it, like or like.
Well, yeah, what's the clinical implication? If you have a patient that can localize their pain, what does that mean?
Like that they could tell exactly where it's coming from.
Okay, they could point to it.
Yeah, kind of like if I guess like if it's like deep, like they could tell like where, like say like if it's in the stomach, like where in the stomach they're feeling it.
Okay. So somebody had mentioned appendicitis earlier. They can localize the pain to the right lower quadrant, right?
Correct. Like they could determine like, I guess if it's like superficial, right? Or if it's like a like deeper.
Well, let's hold on to that thought because it goes with the next one. Who had tearing pain? Who had tearing pain? Oh, okay. So let's hear it, Miss Cecilia. All right. Blood-filled channel ruptured through the aortic wall. Okay. So what kind of emergency is it? Didn't we cover that in medical emergencies?
Which one?
The tearing of the aortic wall?
That's like a load and go, right?
Yeah. So, didn't we talk about aortic aneurysms and medical emergencies?
Yeah.
Okay. So there's a rupture in the aortic wall and it's starting to bleed out. Remember that blood is near to the body. Therefore, the patient's going to describe that pain like a tearing. They will actually feel it in their abdomen. Another way they describe it is like a knife going right through them. And it even radiates to the back. So they kind of localize it to their abdomen and they just say it's going right through them. Now the reason it's a load and go is because it's an aneurysm. It's bleeding out. So when you palpate the abdomen, what are you going to feel?
The pulsating
Distended?
mass.
Well, you'll see the distended abdomen, or you may see the distended abdomen, but somebody else was starting to say it. What was it?
The pulsating mass.
A pulsating mass. And why is that?
Because of the blood loss.
Is it the
Okay,
buildup?
what
of blood?
else? You're right, it's the blood loss, but what else?
Can it be like clots, blood clots?
No, not the clots.
Because when it pumps, it's like releasing blood.
What pumps?
When the heart pumps.
Exactly. Because of that rupture, we have blood that's leaking out, and it's leaking out, it's pulsating because of every pump of the heart. Now, that's in the medical emergency. Now with trauma, can you have an injury that ruptures the aorta, the abdominal aorta?
Yes.
Yes. So look at the mechanism. What's a mechanism you can think of that will cause that?
Like a
And I
blunt
mentioned
trauma.
it earlier. Huh?
Blunt trauma.
Okay, maybe blunt trauma. But what else?
Like a stab wound?
Maybe. Maybe towards the back, yeah. What else?
Like the crush injury.
Not a crush injury.
Could it be high blood pressure?
Yeah, but that's a medical cause.
So a chest injury, maybe.
But we're talking about abdominal injuries.
Working out. That's what Cecilia said.
Yeah, I see that.
Well, they could be working because they're doing so much force.
Yeah, weightlifting, like powerlifting.
Yeah.
And they exert themselves too much, holding their breath, trying to lift. they could also pass out as a result of that, all that pressure. But what about an automobile accident?
Well, somebody said blunt trauma couldn't it be that too? That's why that's why they said that.
Yeah, that's why I was kind of like, yeah, I guess that works. I mean, I don't really think about it as blunt trauma, but all right. So, Miss Ina, talk to us about shoulder pain.
Who do you want to know? I have it right now.
What was that?
I'm like, what do you want to know? Because I have it right now.
I want to know what you know.
Well,
I want to learn from you.
stiffness, weakness, soreness, numbness to the hand, loss of like not strength, but like loss of muscle, kind of the same thing.
Well, what's the clinical implication of all of that?
The rotator thing.
Okay, but what else?
It could be a pinched nerve also.
Okay, but right now that's talking about extremity trauma. That's talking about spine trauma. That's talking about other stuff. But tell me how it relates to abdominal trauma.
Abdominal trauma.
Uh-huh.
Hold on. I don't know.
I'll get to you in a sec, Vanessa.
When you say relates, it's like similar. Like how
Not
is it
similar. Why is it?
Why is it similar?
Like gallstones and stuff like that?
No. Like what?
Like the gallstones? I can't even pronounce it. Like with pelvic problems and things like
Wait.
that?
It was Vanessa raised her hand and then Kayla. Was that what you were going to say also, Kayla?
Yeah, I was gonna say the gallbladder.
Okay. So Vanessa, Kayla, Joanna say gallbladder.
Yes.
Mm-hmm. All right, Vanessa, tell me more about the gallbladder. And also tell me why I'm not like 100% convinced.
Because sometimes with the gallbladder, it's like upper gastric pain that radiates to the shoulder.
Okay, tell me more.
It's not like a constant pain, I think.
Okay. It can be, but. What do you think, Kayla?
Well, I don't know. In my notes, I just have that when you have like gallbladder stones, you get shoulder pain.
Okay.
Like it radiates to the shoulder.
Anything else you could tell me about gallstones? Water.
Well, don't you get abdominal pain when you pass the stones?
Those when you get gallstones, you actually have to remove your gallbladder.
Oh.
What are you thinking, Joanna?
What was it again? Sorry, I wasn't paying attention.
Talk to me about gallbladder and gallstones.
They're just like small little stones that are forming the gallbladder. They're like in the small intestine.
What's the medical term for gallbladder or gallstones?
Cholecystitis. I don't think I'm saying it right.
Cholecystitis.
Yeah.
So, what's the gallbladder used for? It stores bile. What's bile used for?
Did you break down fat?
To what?
Break down fat?
Speak up a little bit more. Something about fats.
It helps break it down.
All right, it helps break down flats or fats. All right, so the liver breaks down the fats. The gallbladder stores the bile that helps break down the fats. All right, now with gallstones, there are stones that build up, are created, and are stored in that gallbladder. The pain, sorry, Menchile. When a person is experiencing pain from gallstones, they're going to have pain, but underneath the right shoulder blade. Why right underneath the right shoulder blade? And this is more typical than upper right shoulder pain. What was that?
Does it have to do with the nerve endings?
It aggravates the nerve, and that's what causes the pain.
Okay, what else?
Oh, the gallbladder's in the right side of the body.
Yeah, but also the gallbladder, the location of the gallbladder is at the level of right underneath the right shoulder blade. Now, what are other signs and symptoms of cholecystitis?
Nausea, vomiting.
Okay, what else?
You urinate blood?
That's more with kidney stones.
Oh.
What else?
Do you have pain like in your abdomen?
Well,
Or is it
it's
just-
the right upper quadrant and radiating to the right shoulder blade.
What about indigestion?
Okay. It's more of it's a burning pain underneath the right shoulder blade. usually precipitated by eating a fatty meal. And it typically strikes women. It's more common in women in their 30s than men. So nausea, vomiting, abdominal pain, right upper quadrant abdominal pain, radiated to pain right underneath the right shoulder blade, precipitated by a fatty meal, and typical of women, or it's more common in women than it is in men. So going back to that shoulder pain, there's something else that I'm more, and actually, I just realized this. We covered this in abdominal emergencies, medical emergencies, cholecystitis. So much for being done by 9 o'clock. So why else is it important? Why do I want you guys to know about right shoulder pain with abdominal trauma? Say it, Joanna.
Oh, I think heart problems or lung problems like
No,
pneumonia.
we're not talking about, no, that would be right over the chest.
But like a heart problem?
But that's, no, we're not talking about chest injuries. We're talking about abdominal injuries.
Yeah, but doesn't it give you like shoulder pain?
Yeah, but again, we're not talking about medical and chest. We're talking about abdomen.
Is the pelvic part of it?
Kind of, sort of.
Like the ovary, like ovary cyst?
But again, that's medical.
We already mentioned pancreatitis.
What was that?
Have we already talked about pancreatitis?
That's going to be over the upper quadrants. That could also radiate to the back. But again, that's a medical emergency. We're not in medical emergencies anymore. We're in traumatic emergencies. All right. So remember I told you guys about blunt force trauma to the right and left upper quadrants? So we also have liver, which would cause right shoulder pain. But what about the left side? What organ is on the left side? What vascular organ's on the left side?
Spleen?
All right. So it's the spleen. So is it bad?
Yes.
Okay. And I'm trying to remember the name of it. All right. So what can cause a splenic injury?
Car crash?
More specific.
Steering wheel? Hitting the quadrant?
Okay, so yeah, but when it comes to an injury to the spleen, We're talking about more or less a localized area. And so like a baseball bat there, a punch, yeah, steering wheel, right over it. And I'm trying to remember the name of the sign. I think it's in your book. But you could have pain over the spleen, but also pain up in the left shoulder.
Kerr sign?
Kerr sign, yeah, there you go. Let's try to remember. So Kerr sign is where the patient has pain over the left shoulder. And yeah, it could be cardiac related, but when we deal with trauma, then we got to think about a spleen injury or a splenic injury. Okay. So that's what the clinical implication is. All right. So who had narrow pulse pressure?
Me.
All right, go for it.
That's when like there's blood loss, right? And that would like lead the patient to go into shock.
Okay. And what is the definition of narrow pulse pressure?
It's significant of blood loss. It has to do with decreased filling time.
But is filling time something that we really measure?
No.
No. So what is the definition? First off, what is pulse pressure?
The blood pressure.
What about it?
What do you like? What do you mean? Like, can you be more specific?
What is the definition of the pulse pressure?
Is it the preload? Preload?
Nope. Anybody, what's the definition of pulse pressure?
It's the difference between the systolic and diastolic pressure.
There you go. It's the difference between the systolic and the diastolic pressure. So what do we mean when we say a narrow pulse pressure?
Is it when they're close, like less than 20? Or...
Okay. So it means it's a small number. So as Vivian said, a narrow pulse pressure is an early indication of shock. So can you have a patient in shock without any other signs of the patient having any type of blood loss?
Say that again?
Can you have the patient in shock without any other signs of blood loss?
Yes.
Okay.
Which is the narrow, what you just said, the narrow pulse pressure is very low.
Okay, but besides that, I can't hear you with that background noise.
They could be taking medications that would
Okay.
sort of mask signs.
What's that medication called? Or what's that family called?
Beta blockers.
What was that? I'm sorry?
Beta blockers.
Beta blockers. Okay. Now, what else as far as patient being in shock and we don't see any outward signs. If there's bleeding, what kind of what kind of bleeding is it? Or might it be?
Internal, because of the vascular structures that it has.
Okay. And how do we know that the patient is bleeding?
Bruising.
Huh?
There's bruising.
Bruising. But is that bruising obvious right away?
No.
No.
No. So looking at the blood pressure and seeing that we have early signs of shock could help us think about shock early on. Because what is one of the treatments for shock?
Covering the patient to maintain body temperature? No?
It is, but that's not what we're talking about here. Myra went over this with you guys the other day. Maybe Paul too. Huh?
Like the high flow O2, 15 liters, non breather, and lay
Okay, beside that.
Lay them supine with their legs elevated.
And
rapid transport.
Rapid transport. You could do the rest of the stuff en route. But what's the most important thing? Haul ass out of there. Signs and symptoms of shock are rapid transport things. And the other stuff, yeah, we want to do that, but let's just do rapid transport. Okay? All right. All right, who had the knees drawn up to the chest?
I did.
All right, let's hear it.
They're guarding themselves from some type of injury or pain to the abdomen.
Okay, and why do they do that? Why is it important?
Because they're trying to like protect themselves and like relieve the pain.
How so?
By just like keeping their stomach kind of close to their legs, like almost holding it in.
Well, why is it doing it?
By applying pressure?
By putting pressure or relieving pressure?
Both.
No. In this case, you can't have both.
By applying pressure.
No.
By relieving it?
Yeah, remember, it relieves pressure, it takes pressure off the abdominal muscles. They have pain. So if a person's in pain, do you want more pain?
No.
But how does it release in pressure if you're putting your legs up?
Because straight, you're pulling on the muscles. By bringing your legs up, you're relieving that pressure on the lower abdomen.
I have a question.
Yes, ma'am.
So is it like protocol for us if we were to transport a patient who has like eviscerated abdominal organs to have them like knees up?
Yeah, you'll draw the bend the knees. It's actually bending the knees to help relieve that pressure, and that's exactly what I was going to ask you guys. If you have a patient with abdominal evisceration, how would you treat it? And part of it is draw the knees up. How else would you treat that abdominal evisceration? Anyone?
Applying moist, sterile gauze.
Why?
To keep it moist.
Yeah.
Dried organs die.
Dry up.
Okay. Anything else?
Occlusive dressing.
Why?
So air doesn't get in and out on the abdominal organs.
Okay. I'm surprised you guys didn't say high flow too. 15 liters of downward breathing.
I mean, well, that too for shock.
All right. And who had the last one? That was Vanessa.
Sorry, I was on. I was on mute. I had the last one.
All right, let's hear it.
And arms folded across the abdomen. Is also like a patient that's having abdominal pain and is kind of protecting their abdomen.
What do you
because
call
of
that position?
Oh.
What did you say?
What do you call that position?
Is it fetal something?
No. That was the knees drawn up. So Miss Vanessa, what do you call it?
I have no idea.
Anybody know?
Was it close?
No. Or you work for the knees drawn up to the chest. It's called the fetal position.
That's what you asked, no?
No, arms are folded across the abdomen.
Oh, great.
Guarding.
Oh yeah. Well, I said that, guarding the abdomen.
But I wanted, yeah, but that wasn't the name of the position.
Oh, okay.
Just say what they're doing.
Look at Lou.
So is that something to note in your documentation with your pregnant positive and negatives?
Yes.
Yes, it is. So one thing, and they are kind of common, but things to look at: nausea, vomiting, diarrhea, maybe blood in the stool. Later on, I think we're talking about. Actually, are we?
So that position is called guarding?
Yes.
Okay.
Another thing too, since we're talking about genital urinary, as Claudia mentioned earlier, blood in the urine. What can cause blood in the urine?
Kidney stones?
Kidney stones.
What else?
UTIs?
We're not talking about medical now.
Blown force trauma to the abdomen?
Okay, what else?
Maybe blunt force trauma to the kidneys.
Blunt force trauma to the kidneys. And why did I say what else? Because are the kidneys in the abdomen?
Yes.
No.
Where are they at?
Towards the back.
Yeah. What do we call that?
Retroperitoneal.
Retroperitoneal. So kidney blows can cause blood in the urine. You could have injury to the bladder. As far as genital injuries, not a lot to do. For male, obviously it's a code 3 transport, right, guys? It's important. Code 3, regardless. You want to save certain areas. Now, for the ladies, if they have genital injuries, you usually will have vaginal bleeding. It could be from sex assault. It could be from the double-headed dragon. It could be, I don't know. It could be from horseback riding. The way that we treat them, and I mean the injuries, I don't mean the women. The way we treat the injuries is like a soft tissue injury. The one thing, remember we talked about it the other day, like you don't pack the nose, you don't pack the ears. Same thing here, you don't pack the vagina. Okay? Get your mind out of the gutter, Ina.
What? I'm telling you, because this happened to me. I hit myself with
Do I even want to know? What, from horseback riding?
I was in a quad and I was riding like in the front and we hit something and I hit myself down there.
Started bleeding?
A lot. It was like a cut on your lip, but like deeper.
You do know what you just said, right?
Oh, well, yeah, it was that, right? But yeah, it's bad.
Yeah, but it's a soft tissue injury. Believe it or not, that virgins, when they go horseback riding, if they ride too hard, like when the horse is really galloping, it could actually break the hymen. So that occurs as well. But again, it's a soft tissue injury. Just you don't pack the vagina, but just like you would with the nose or the ear, just put gauze or like a maxi pad type of thing, or abdominal dressing works, just to soak up the blood.
You don't pack any holes, right?
Exactly. Yeah, that's the best way to say it. So no tampons up the butt with hemorrhoids either.
Not even gunshot wounds?
Packing them?
Huh?
It depends where and how, and then it depends on what you're talking about with packing. Something like that, you can, like with that hemostatic dressing. And they have one now that comes like in a syringe or like a tampon type thing, and there's a bunch of little gauze in there, and you put it on the wound and you just inject it in there, and it injects all these little pieces of cotton or something material, and it absorbs it.
That's what my friend was telling me.
That's
Yes, sir. I'm here.
It's all coming from you.
I'm sorry.
Can you see it in here? Ooh. So there's the answer to your question. But other than that, no. Questions, comments?
No.
You guys didn't like this, did you?
Nah, I'm good.
Liar. I want to make sure that you guys are keeping up with your studies. Be prepared. I want to see your guys' ability to think. Okay. Here's the bad news. When you're on a call, you can't have your textbook right there. It has to be in your head. Even when you pick up grandma or grandpa or dad to take them to dialysis. Hi, sir. How are you today? We're here to pick you up. We're taking you over to dialysis today. How you been? Oh, okay. All righty. Well, I'm Lou. This is my partner, Carlos. He's going to be driving us. So just know he drives like a maniac. So I do have a MSS bag for you in case you need it. Just let me know. We'll get going in just a minute. Gonna go get a report. We'll be right back to put you on our gurney, okay? And in the meantime, my partner, Carlos, since he's an awesome partner, he's gonna get vitals for us. He's gonna take them. He's not gonna ask the nurse, what'd you get? He's actually gonna do his job. The reason I say that is because I heard of a company that it's not Life or Elite, that they're lazy people. Don't be one of those. If I ever find out you're doing that, I'm gonna smack you.
So what do? They basically just be like, hey, what are the latest vitals? Or what?
Yeah. And then they sit behind the driver and not pay attention to the patient. Don't be those people. Trust me. Luckily, I don't have any relatives that require any ambulance transports. But you should have seen it when my dad was in the nursing home. Dominion came in to pick him up, and one of Paul's students sees me there, and his expression changed. He lost color to his face, and he was nervous as hell because he saw me right there. And the interesting thing was my dad said that they were friendly. There was only one thing he didn't like about Dominion. They drove like shit. So people know people. I know people. It's been interesting. These last couple of classes, I haven't had a lot of students write out with former students, but other classes, oh, they do. Believe me. Believe me, they're out there. Anyway, do you guys have anything?
No, sir.
You guys ready for the quiz? Tonight? Or the last one? No, I'm messing. You'll get a quiz on Wednesday. So, a reminder: next Friday, I'm not in town. I still haven't decided if I'm going to give you guys class from California or not. Although people are yelling at me and saying, "You're on vacation, don't work." But I'll let you guys know. But next week I'm out.
This Friday?
No, next Friday.
This one. Okay.
Yeah, next Friday is already August. Actually, this Saturday is August. So, do I have any other volunteers for Friday and Saturday?
I can't. My freaking schedule changed. And I'm dying.
Hey Lou, I should be available for Saturday as well.
Okay.
No, I can help you out.
I appreciate it. Yeah, I need a lot of help because I know the advanced classes are not going to be helping much. I could probably count on 2 of them. But by having enough people, we should get this done pretty quick. So,
Hey Lou, I have a question.
yes, ma'am.
On the grading scale, what is a B?
83.33 to 90 or 83.3 to 91.6.
Okay. 83.3. Thank you.
Welcome.
Are you doing it on your phone?
Well, yeah, we don't have internet.
Huh?
We don't.
So, all right. Anything else?
No, sir.
No, sir.
All right then. With nothing else, I will let you guys go so Ina can get some sleep.
Thank you, sir.
You're welcome.
I'm sorry, guys. Have a good night, everybody. Bye.
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 Have a good night.
Stay out of trouble, everybody.
You too.
I'll try. No promises, though.